Okay, so for this first step, we already have arterial access in the right groin. There's a sheath placed, a 5 French sheath, and what we're going to do is we're going to introduce this 5 French base catheter. Now, there's many different catheters that you can use. For this procedure, we're going to use a C2 catheter or a Cobra 2 catheter in an 035 wire with an angle on it. So I'm going to go ahead and introduce the catheter into the machine, into our patient, and we're going to introduce the wire as well. Okay, now it notices the wire, and now we're going to do the catheter. You're going to see me track up from the right groin, and what we're doing is we're getting up above the bifurcation of the left and right common iliac arteries. I'm going to pull back my wire, and now we're going to pull down the catheter, turning the catheter until we point towards the other contralateral leg. There we go, and I think we've engaged it. So what we're going to do is we're going to get the wire down that other leg. And sometimes it's going to be a little tricky. There we go. And we're going to run the catheter over the wire, as you can see. And we're going to point medially so that we can find out where the origin for that internal iliac artery is. Alright, so we're going to do a little injection here now. And that's going to show us both the external and internal iliac artery. We can see there that I'm very close to the origin. We're going to have to skid down a little bit farther. And that should be in the internal. So we're going to come down into that internal iliac artery, pull back the wire, and do another injection. And right now you can start to see pooling here where the bleed is. The contrast is actually pooling there. That's where the area of bleeding is, and that's what we're going to try to catheterize now. Internal iliac artery on that side, and now we're going to get into the selective branch that's feeding that bleed. What we're going to use is a microcatheter. You can see here it's a much thinner catheter than our base catheter. Okay, this is actually a 2-4 French catheter, and this wire here as we're using it is a micro wire. And again, this is a much smaller, thinner wire, useful for selection of these small branches. And this is going to be an 014 wire. Okay, so we're going to introduce both of these through our 5 French base catheter. Until it's recognized by the Mentis unit. Alright, there we go. So it recognizes the microcatheter and the wire. So now we're going to do fluoro. You see where we are. And you can see that our microcatheter and microwire are coming out of into one of the branches of the internal iliac artery. So let's select this branch and see where we are. So we're going to get into this branch just a little bit farther. Okay, I'm going to pull back and we'll do a slight injection here just to see where we are. And you can see that's the branch that's feeding this bleeding. So what we're going to try to do is try to get this catheter out as far as we can into that branch. So I'm leading with the micro wire. And you can see there I'm going up into a branch vessel. That's a very small branch vessel, as I can tell. So we'll get a little bit farther. That's downward going branch vessels. That's not what we want, so we're going to try to select something slightly different. Come into this a little bit farther. Now let's see where this is. So we're going to do a little injection here. And you can see we're in a small little branch, so we're going to want to come back. Do an injection from here. And you can see that's the branch that we want, so let's try to select that. There we go. We're going to get right up to the bleed here. Again, we're going to move that microcatheter over the micro wire. We're getting very close. Okay, so we now track the microcatheter out into the branch that's selectively supplying the bleeding. I'm going to do a little injection here again to show you guys. Right there, that's the branch that goes right over the bleed, and you can see the bleed getting worse as I inject. So now what we're going to do is we're going to move the micro wire, and instead what we're going to do is we're actually going to put a coil here. And right now my catheter is distal to where the area of bleeding is, and what we're going to do is a sandwich technique for this. So what that means is I'm going to put a coil out here, distal where the bleed is. You can see the coil coming out. I'm pushing it out right there. Now the coil's out. And now we're going to pull back the microcatheter before the bleed. And we're going to put another coil here. Now before I do that, I want to do a little gel foam. Gel foam slurry is an embolic that we use. It's a temporary embolic, and you just push it out with contrast. So right now we're going to do that. So I'm going to select for our microcatheter some gel foam slurry, and we're going to slowly deliver that to the microcatheter. So right now, while we deliver this, I'm going to collimate a little bit more right over the area of interest. And right now you're going to see a little bit of that contrast coming out, and that's actually a gel foam slurry. So we'll give a little bit here until it starts to slow down. Right there, we see that the gel foam's hanging out for a bit longer. And then what we're going to do is we're going to switch over now to put another coil here right before that area of bleeding. So we're going to go ahead and put that coil in. You'll see it come out on the screen in just a second. So here comes the coil. You see I'm going to push it out through my microcatheter. You can see there it's starting to form. And once the form, we're going to push a little bit more out. There it's forming, it's forming, it's forming, and now it's out of my microcatheter. All right, so now we're going to pull back the microcatheter even farther. Just a little bit farther. And what we're going to do is we're going to continue to deliver some more gel foam. So here we go. We'll give you a little bit more gel foam here, just behind the coils until we see that it stops bleeding. What we're going to do is we're going to get a little bit closer to the area of bleeding. With our microcatheter microwire, so I'm going to get back up to that area of bleeding. We're going to get our catheter right there. And what we're going to do is we're going to deliver a little bit more gel foam here. So we're going to go ahead and deliver more gel foam. And you can see it's going right into that area of bleeding. There's a little bit of reflux into another branch. Now you can see it's kind of stagnant. And we're getting stasis here. Alright, that's probably a good endpoint. What we're going to do now is we're going to pull out our microcatheter. And we're going to do a final run through our base catheter. Okay? So right now my base catheter is still in that one area. We're going to do a ESA for here. So we're going to pull down the pedal, inject, and now you can see there's no more filling of that area of bleeding. This is a successful embolization. Okay, so today we're going to show you how to make some gel foam that we used in this procedure. This is the gel foam package that we have here. What we're going to do is we're going to open the package. There's an inner sterile portion. We're going to flatten out the gel foam. I like to flatten it out before I cut it or rip it into small pieces. And you're going to see here, this is what the gel foam actually looks like. So it's a material, it's an embolic material that's temporary. It's made of collagen. So what we're going to do is here is I like to rip it into small pieces, and we're going to put it into a syringe that's attached to a three-way. So what I'm going to do is I'm going to fold it in half, and you can do this with a scissor too, with a sterile scissor during the procedure. What we're going to do is going to cut it in half, cut it in half again, cut it in half. And you want to keep cutting it in half until you get to smaller and smaller pieces. And this will make it easier for you later when you get it through this three-way. So we'll put all those little pieces into here. Again, we're going to rip them into smaller and smaller pieces, cutting in halves and halves and halves until it's into small little pieces, as much as we can rip it. And again, we put all the pieces in here, and we're going to flatten out these pieces, get all the air out of the syringe, and then you're going to hook up another syringe. Now this can be mixed with half contrast, half saline, or all contrast, depending on what you like in terms of visualization. And then we're going to swish it through this three-way stopcock, and we're going to do this somewhere between 10 and 20 times, okay? And that's going to make us form a slurry And that's what we're going to use. This is going to be this gel foam slurry. So after I do that about 10 to 20 times, what we're going to do is we're going to leave it and connect a small syringe for delivery. So a 1 cc syringe or a 3 cc syringe works perfectly fine. And you can see here that we swish it through and we get that gelatin, that gel foam sponge in here mixed with the saline and the contrast. And that's what we're going to be delivering through our microcatheter. I'm briefly going to demonstrate a closure device that we commonly use for these type of procedures. Although not necessary, you can always just do manual compression. This is called a PerClose device. It comes with the ProGlide here device. And this is actually introduced over a wire. You have here the piece that comes for the clipping and also for cinching down on the suture. So the first step is you introduce this over a wire. And what you're going to see is the wire come out of these little out of these little markers here. And let me show you that now. So here's the wire, and we're going to introduce it. So you would backload this over the wire. And again, you would see it come out between those two indicators on this device. Once you get into the arteriotomy, then you're going to pull out the wire. So the wire will be pulled out to the patient. And you'll just introduce the rest of this catheter, this device, until you no longer see any bleeding. And this is after the sheath has been removed. The first step is this number one. What you're going to do is pull back the foot plate. And then what you're going to want to do is pull back, and the bleeding that you see through this indicator should stop. Once you have that, you know you're against the arteriotomy. You can see that there's this foot plate here. And what you're going to do is you're going to fire the suture. So you're going to press 2 here. Okay, that's going to fire the sutures. Alright, and those sutures are going to go right around where the arteriotomy is. Then you're going to do number 3, which is pulling this back to release the sutures here. And what you want to do is you want to cut it here on this device. So you're going to bring this over. And around, and you're going to cut it. Okay? The next step is that you're going to pull this back. You're going to pull this back until you see those indicators again. And you're going to reintroduce the wire in between these indicators. Once you do that, you're going to see that your sutures come out as you pull this farther and farther back. And what you're going to have is 2 sutures. Now these 2 sutures, one is going to be white and one is going to be blue. And what you're going to want to do is cinch down the blue first. And you see what that does is it cinch down this knot. The way you do that is you're going to use this device here, and you're going to wrap it around the blue there, so there's a little gate there that it connects to. You're going to pull that down and cinch down on it. Okay? Once that's cinched, then you can pull on the white string here, this white ended string here, and what that does is going to lock the knot down. The final step is you're going to use this gate over both pieces of the suture. Here. You're going to drive that down to the knot, and then you use the red button here to cut it. And what that does is that's going to cut it right at the knot right there, and that's going to close your vessel. So those are basic steps for using the PerClose device.